Simone de Beauvoir once stated, "The fact that we are all human beings is infinitely more important than all the peculiarities that separate human beings from one another." I'd like to welcome you to the Lansquenet Library, here inside the Hospital of the Holy Spirit in Rome, Italy, and I appreciate your attention. Behind these doors is a history of medicine dating back to the 14th century. While the disease we're talking about today does date back farther than that, it is just as important to learn about. That very disease is called cerebral palsy. We'll be digesting just what it means to have cerebral palsy, including the history, the fight for a diagnosis and current treatment options available today, and finally, the outlook on the lives of those afflicted with the disease. Please watch your step as we enter the library. And remember, questions are so very welcomed. Before we go ravaging through the shelves which hold some of the oldest medical records today, let's take a look at the definition of cerebral palsy. According to the Mayo Clinic, cerebral palsy is a congenital disorder of movement, posture, and muscle tone due to abnormal brain development, often before birth. Now that we know the definition, let's get into the history. While the first known descriptions of cerebral palsy goes back to the 5th century BCE by the work of the Hippocrates, it wasn't until the 1830s where an English doctor, referred to as Dr. John Little, began his research into what was then called Little's disease. He would go on to become a pioneer for cerebral palsy, as his work set the stone defining cerebral palsy as a brain injury caused by oxygen deprivation. Little's disease would go on to become what's now known as spastic cerebral palsy. 5 years later, two men by the name of Sir William Osler and Sigmund Freud would go on to give cerebral palsy its name and learn so much more. Their combined knowledge of cerebral palsy would go on to set the standards of diagnostics and treatments for centuries to come. On the door to your right is the Diagnostic and Treatment Center, and inside you will see a research article published by cerebralpalsy.org stating the difficulties families have in getting a diagnosis, saying, "Diagnosing cerebral palsy takes time. There is no test that confirms nor denies it." As you may imagine, this is extremely emotionally tolling on concerned parents who realize their child isn't developing as they should, that they're missing important milestones. A diagnosis can occur anywhere from 18 months of age to 5 years. Because of this, children who are suspected of having cerebral palsy are often sent to specialists who test the big four, which include reflexes, posture, muscle tone, and movement. Imaging such as MRIs and CT scans do help give a better insight of just how the brain is developed. However, it's a combination of the two that truly sets the definition of a diagnosis. My father was lucky. At the age of 3 and after 6 months of testing, he was diagnosed with spastic diplegic cerebral palsy. Spastic meaning inverted, stiff muscle tone, diplegic meaning lower extremities. Unfortunately, there is no cure for cerebral palsy. It's a lifelong illness that treatment depends on the severity of each individual case. Generally speaking, some of the treatments can occur: muscle injections and/or relaxers, physical, occupational, and behavioral therapies, and in severe cases, surgeries to either correct limb deformities and/or cut nerve fibers to help manage pain. At our last stop here at the Lansquenet Library, I'd like to dust off the book on the quality of life. As stated earlier, cerebral palsy sits on the spectrum. No two cases are alike. On one hand, a case can be so mild that the only symptom present is a limp in the way one walks. On the other hand, so severe that the individual is confined to a chair, unable to speak. This is why the quality of life is difficult to say. The National Library of Medicine confirms this and goes on to further state, the quality of lives of those diagnosed with cerebral palsy is invariably more affected. However, the connection between cerebral palsy and the psychosocial quality of life is less clear. You may even ask, is there a life expectancy shortage? And unfortunately, there is. In severe cerebral palsy cases, there is a lot of correlated health problems that lead to deterioration. Because of this, those individuals are only expected to live from late 20s to early 30s. On a general level, those with cerebral palsy live from late 40s to early 70s. However, before we close the book of Quality on Life, I'd like to state that no matter the differences in abilities, their lives can be just as beautiful. As we end our tour, I like to think that I was able to provide you a better insight of just what cerebral palsy is. On the stops along the path, we learned about the history, the diagnosis and treatments, and finally, that outlook on life. I'd like to thank every one of you for joining me today on this tour, and please remember that we're all humans and deserve respect.